Welcome to Allie's Attic, where you never know what kind of surprises you'll find in my attic. I'm your host, Allie, and it's time for Allie's Thought of the Day. My thought of the day is about my disease, rheumatoid arthritis, autoimmune disease. Now, I've asked a couple of arthritis people to come on my show and talk to me about this. So far, I haven't got a response, but I'm sure I will. The reason that I'm talking about this today is how it affects my brain and how I forget things or just all kinds of stuff. So I'm going to start off with reading the medical term for RA, and then I'm going to talk about my personal experience. So arthritis means inflammation in a joint. That inflammation causes redness, warmth, swelling, and pain within the joint. Rheumatoid arthritis affects joints on both sides of the body, such as both hands, both wrists, or both knees. This symmetry helps to set it apart from other types of arthritis. RA can also affect the skin, eyes, lungs, heart, blood, or nerves. What are the symptoms? The warning symptoms of RA are joint pain and swelling, stiffness, especially in the morning or after you sit for a long time, and fatigue. Rheumatoid arthritis affects everyone differently. For some, joint symptoms develop gradually over several years. In others, it may come on quickly. Some people may have rheumatoid arthritis for a short time and then go into remission, which means they don't have symptoms. Who gets rheumatoid arthritis? Anyone can get RA. It affects about 1% of Americans. The disease is 2 to 3 times more common in women than in men, but men tend to have more severe symptoms. It usually starts in middle age, but young children and the elderly can also get it. What causes it? Doctors don't know the exact cause. Something seems to trigger the immune system to attack the joints and sometimes other organs. Some experts think that a virus or bacteria may change the immune system, causing it to attack the joints. Other theories suggest that in some people, smoking may lead to rheumatoid arthritis. Certain genetic patterns may make some people more likely to get RA than others. It totally runs in my family. How does it affect the body? Immune system cells move from the blood into the joints and the joint lining tissue called synovium. Once they arrive, those immune system cells create inflammation, which wears down cartilage, the cushioning material at the end of the bones. As the cartilage wears down, the space between the bones narrow. As it gets worse, the bones could rub against each other. Inflammation of the joint lining causes swelling and makes fluid build up within the joint. As the lining expands with inflammatory cells, it can produce substances that damage the bone. All of these things cause the joint to become very painful, swollen, and warm to the touch. How do doctors diagnose rheumatoid arthritis? There is no single test that shows whether you have RA. Your doctor will give you a checkup, ask you about your symptoms, and possibly perform x-rays and blood tests. Rheumatoid arthritis is diagnosed from a combination of things, including the location and symmetry of painful joints, especially in the hand joints, joint stiffness in the morning, bumps and nodules under the skin, rheumatoid nodules, results of x-ray and blood tests. Most, but not all people with rheumatoid arthritis have the rheumatoid factor, RF, antibody in their blood. Rheumatoid factor may sometimes be present in people who do not have rheumatoid arthritis. Therefore, the diagnosis of rheumatoid arthritis is based on a combination of joint problems as well as test results. A newer, more specific blood test for rheumatoid arthritis is the cyclic citrulline antibody test, also called anti-CCP. The presence of anti-CCP antibodies suggests a tendency towards a more aggressive form of rheumatoid arthritis. People with rheumatoid arthritis may also have mild anemia. Blood tests may also show an elevated erythrocyte, I can't even say these words, sedimentation rate, ESR, or elevated C-reactive protein, CRP, levels, which are signs of inflammation. Some people with rheumatoid arthritis may also have positive anti-nuclear antibody tests, ANA, which indicates an autoimmune disease, but the test does not specify which autoimmune disease. How is RA treated? Treatments include medications, rest, and exercise, and in some cases, surgery to correct the joint damage. Your treatment will depend on several things, including your age, overall health, medical history, and how severe your case is. Medications. Rheumatoid arthritis medications can reduce joint pain, swelling, and inflammation. Some of these drugs prevent or slow down the disease. Drugs that ease joint pain, stiffness, and swelling include anti-inflammatory painkillers such as aspirin, ibuprofen, or naproxen. Pain relievers that you put on your skin, steroids such as prednisone, and narcotic pain relievers. There are also many strong medications called disease-modifying anti-rheumatic drugs, DMARDs, which work by interfering with or suppressing the immune system attack on the joints. They include Plaquenil, originally used to treat malaria. Immune suppression drugs such as methotrexate, which is what they used as chemo when leukemia first came out, so it's a very mild dose. Biological treatments such as abatacept, Orientia, Humira, Amgeveta, Kineret, Cimzia, Enbrel, Simponi and Simponi area, Remicade, I can't even say it, Rituzan, Actimera, Aravel, and Azofidine. Why rest and exercise is important for RA. You need to be active, but you also have to pace yourself. During flare-ups, when joint inflammation gets worse, it's best to rest the joints. Using a cane or joint splints can help during flare-ups. When joint inflammation gets the better of you, you need to exercise to keep your joints flexible and to strengthen the muscles that surround them. Low-impact activities, such as a brisk walk or swimming, and gentle stretching can help. You may want to work with a physical therapist at first. Why is surgery needed? When joint damage from the rheumatoid arthritis has become severe, surgery may help. Is there a cure? Although there isn't a cure for rheumatoid arthritis, early aggressive treatments have been shown to help prevent disability and increase the chance to attain remission. Now, it also takes years off your life. I'll tell you what it does to me now that I've read all that stuff. I was diagnosed 6 years ago. They think I've had it much, much longer. It affects my left side more than my right side, especially my leg and my back. Flare-ups are awful. I get, it's kind of like a sunburn all over my face and my neck. I'm constantly tired. I don't want to go anywhere. I don't want to do anything. It causes depression. It causes anxiety. I'm scared to go anywhere because what if I have a flare-up and I turn red? I also get very nauseated and there is a lot of vomiting involved. So I guess I've become an agoraphobic, I think is the word, where you don't leave your house. I also take way too many drugs. My doctor is really, really good. My family doctor. I'm not talking about my rheumatologist because I'm not very fond of him. But my family doctor has tried to get me off as many pills as he can. Unfortunately, I just had to go back on them again because my flare-ups are happening every single day. So the drugs they put you on, I'm on morphine, and I'm on a high dose of morphine. And I take my methotrexate shot, I give it to myself every Friday, and then I'm sick for the entire weekend. So between the methotrexate making me sick and having these flare-ups, which don't seem to go away, my life in the last little while has been absolute hell. Which is why I love being able to do this show, because I can do it when I feel good. The bad side of doing this show is, I don't know what the word is, but there's a word for when your brain doesn't work properly because of all the drugs you're on and because of the disease that you have. This disease has also attacked my heart. So I have a this is hard to say, left bundle branch blockage. So I, of course, have to go to a cardiologist. It's an invisible disease, like lupus and like fibromyalgia. So when you tell people that you're sick and they look at you and you look fine, they don't believe you. I've been called a hypochondriac, which hurts because I do have a disease, whether you can see it or not, and I have to live with it every single day. So my thoughtfulness is the part that bothers me the most. I think that I've looked at things and made sure everything's okay, and then I find out, oh no, my God, I missed something, and then I'm scrambling to fix it, and it's just very, very hard on a person. There's times where I'm absolutely bedridden, where I do not want to get out of bed. I hurt like crazy. I'm tired. I just want to be left alone. And I know it really bothers my family because they don't like seeing me like that and staying in my room and not really being social. They're very happy that I started this show. Now, if I could just start making money at it, I'd be happy too. So anyways, that's my thought of the day. I just wanted to let everybody know how RA affects me, what RA is, and that we will be having people come on to talk about RA as much as I can possibly get them on, because obviously it's something that's near and dear to my heart. And if there's tricks that other people have or know of that can make this disease more bearable, I'm all for it. So if you listen to this and you do have RA, or even if you have fibromyalgia or lupus or anything like that, that's an invisible disease and you have to live with the fact that people don't think you're sick, definitely contact me on Twitter. It's Allie's _ attic1, and you can also find me on Facebook at Allie's Attic. So thank you for joining me on Allie's Attic. Keep checking my website because you never know what kind of surprises you'll find in my attic. Cheers.